Good afternoon. My name is Dara, and we're going to talk about vector-borne diseases today. Firstly, pathogens that are carried by vectors, such as mosquitoes, ticks, and fleas, cause occurrences of vector-borne diseases, and those usually lead to stuff like malaria, dengue, and Zika, which in turn can also affect climate change, because an increase in malaria, dengue, and Zika is mostly caused by climate change, and that also increases like the range of infectious diseases as well. Globalization enhances the flow of human beings, which contributes to the spread of diseases because, international travel makes it easier to spread the diseases and makes it be brought to new areas, spreading out all over and broadly. The health burden, millions of people around the globe, particularly the tropics, are victims of health-borne diseases, not just everybody really, mostly the subtropics because they're hit by the temperature, and so they're heavily impacted by vector-borne diseases. The location in specific region, um, sub-Saharan Africa is the greatest region that is impacted by the malaria, while Southeast Asia and Latin America are mostly affected by Zika and dengue. The global map here shows how impacted each diseases and the locations and parts of the map that it impacts the most. The environmental aspects is warm climate and seasonal precipitation encourages the growth of vectors because they usually like warmer climates, and it helps them. I guess it helps the mosquitoes and stuff that they grow more in warmer climates, which is not good for the environment. Uh, to explain the environmental concerns, um, malaria is a disease. Is malaria, dengue, and Zika are the most notable diseases that are transmitted through mosquitoes. Malaria is a disease transmitted through the Plasmodium parasites through Antelopes mosquitoes. Dengue is a virus that is spread by Aedes mosquitoes, which carry dengue, and Zika is also caused by Aedes mosquitoes as well, which has an impact on the nervous system. Um, Vector breeding, vectors breed in standing water and warm and damp conditions, as I mentioned earlier, because mosquitoes breed in usually warmer tropical weather. That's usually their best, I guess, environment to be in. But due to some advantages of climate change on some of the mosquitoes, the diseases have entered into new regions that were not originally affected, which is why it's important to understand the environmental conditions which favor these vectors in order to deal with the issue at hand. Um, Impact on the local environment, biodiversity destruction. The usage of pesticides to combat vectors destroy the local species, water systems, breeding grounds, interfere with the natural water ecosystem, soil and water quality can be destroyed by the runoff of insecticides. Deforestation provides diseases, causing mosquitoes with new habitats to grow. Implication on agriculture. Outbreaks of these diseases affect the agricultural communities because of the storage of labor force. Impact on the community and the people. Vectors end up being a big burden toward the community because health burden, there's a high morbidity and high mortality amongst the population that are affected. Economic costs, medical costs and productivity. It endangers, groups of people, children's, elderly, and pregnant women are the most susceptible to the impacts of vector diseases. Social disruption, disease outbreak disrupt the education, participation in the workforce, because schools get canceled, and some people aren't able to get to work on time because of dangerous diseases that affect their environment. The burden There's also a burden in the healthcare system. The local health system becomes overloaded with diseases and outbreaks, causing to just being overloaded. They really can't get everywhere at once, so it's just dangerous for everybody involved, usually. How it connects to climate changes, such as climate changes as a cause of a vector expansion, the environmental health issues that are addressed through public health, um, green development and curbing the disease transmissions, environmental justice, imbalance, impact on poor communities, and health systems. There is a requirement of better infrastructure within vulnerable areas. All these are different themes that we've covered through the year, that relate to everything about climate change and like population health. And, that's how it relates to the class this past year or this past semester. Solutions and what's being done. There are a number of current initiatives to address the problems of vector-borne diseases. One of them is malaria prevention nets covered in insecticides. Insecticides treated nets have been shown to be effective in mitigating malaria transmission in malaria epidemic areas, which is something that could help in, as a solution to the problems. Vaccination against malaria and dengue, climate managerial measures, early warning systems, habitat management. Habitat needs to be reduced, and international cooperation from the World Health Organization and other organizations, because uh, all these organizations can play a big role in helping the environment and curing from all these different diseases that are around. So all these organizations could play a big factor in stopping vector-borne diseases. Uh, to further fight diseases, some of the solutions I came up with were biological mosquitoes to decrease population of vectors, preventive public health education, such as insect repulsives and good sanitation, enhance infrastructural capacity of the affected areas in healthcare, implement global laws to manage movement and spread vector, and encourage green areas to curtail the mosquito habits. Because, green areas and urbanization limit the breeding grounds of these mosquitoes and can aid in curbing the spread of these diseases. Uh, so, in conclusion, the world crisis of the occurrence of vector-borne diseases is an impending phenomenon that is mainly brought about by climate change. Malaria disease and dengue disease have been spreading in millions, with new locations being affected annually. The initial move is to address the further harm by strengthening the healthcare systems, enhancing population education, and investing further into innovative solutions. Concentrating on international cooperation is also noteworthy as the international health bodies closely coordinate themselves and coming up with effective strategies against vector-borne diseases. Which is why, by working together, we'll be able to propose a solution to fully eliminate these diseases and protect vulnerable groups from being affected and harmed by vector-borne diseases. The reference page for the project, and thank you very much for listening.